Odds are, after you had your total knee replacement, one main goal came to mind: to maximize the success of your surgery. You're here in this video right now, which shows that you are willing to do what it takes to make sure this new knee can support you in returning to your active, adventurous life. As a physical therapist who helps patients recover from total knee and hip replacements in a home care setting, one big mistake that a lot of people were making that led to continued limitations and pain is not continuing to work on strength, balance, and stamina. In my personal opinion, I think total joint rehabilitation stops too early, especially for those who are looking to return to doing those activities that require a higher level of strength. In this video, I'm going to show you my top 3 favorite movements to help you thrive with a total knee replacement. This knee compression sleeve signifies this is the surgical leg, so you can see the specific positioning on these exercises. These exercises are recommended if you are at least 6 weeks or more post-op. Please note that everybody's recovery is going to be different. It may be quicker or it may be a little bit slower. I will be giving prerequisites to each of these exercises to make sure you're ready. This first exercise, you're going to need a chair. The prerequisite to this is making sure you can complete 10 sit to stands. So sitting down and standing up rather easily and rather comfortably, meaning without significant pain. Once you're able to do that, this is a progression, a very important progression, because now we're going to be working on single leg strength. We need to build that leg back up. With this surgical leg, I'm going to slide my heel back as far as my knee bending will allow. If you're still working on that, that's okay. We do at least want it to be at 90 degrees though. If you can, I would like it a little bit further, but don't force it. I'm going to take my opposite leg and slide my foot a little bit in front, so my feet are in a staggered position. Keep your feet in this exact same position and stand up and then sit back down. If you need to use your arms, that is okay. You are standing up and sitting back down. What this is doing is putting more weight through the surgical leg. You can run through 10 of these and see how it feels. If you're having difficulty at first, move that front foot back. That's going to make it easier. Start easy, and then you can work your way up. You want to make sure that you're not overdoing it, because sometimes you may experience pain after doing an exercise and not during. So start conservatively, and then you can increase the challenge when you know your body can respond appropriately. You can also do the other side, and the reason for this, it can be a great way to see and compare to the strength that you have on the surgical side. If I have my opposite leg back and I do 10 repetitions, I can see essentially how far the surgical leg has to go in order to match the other leg. So you can use it as a comparison of your progress. For this next exercise, you will need a step. I like to use this shorter step stool, especially when getting started, because you may not be quite ready for a regular height stair. The link for this step stool will be down below. The prerequisite for this is being able to stand on your surgical side, tap up and tap back, tap up and tap back. Once you're able to successfully do 10 of those without significant pain, holding on to something is okay. Then you can attempt this next one. This is a progression working on range of motion and single leg strength. I'm going to put my surgical side on top of this step and move my non-surgical side back. So I'm in this wider staggered stance. Bend your knee forward as far as you feel comfortable. Then push it back straight. Bend it forward and then push it back. Working the strength, but also the bending and straightening. This gives you a little bit more leverage, especially on the bending piece, because you're using your weight to add a little bit extra motion. This one can be gradually worked into though. Start with just a very gentle bending until your knee starts to warm up, and then you can start to push that. Now this back leg can be doing whatever is comfortable. You can keep your heel on the floor and keep the leg straight. You can pick the heel up this way. If you're feeling a very intense calf stretch in the back, go ahead and bring that foot forward a little bit. The goal is to complete 10 of these. You can start just on the surgical side working through this. If you want to compare with the other side, you can do that. In this case, if the surgical leg is in back, I would work on keeping that leg straight because that's going to be working on that terminal knee extension. So you may need to bring it forward a little bit in order to maintain that straight. Exercise number 3 is going to be focusing on balance. I highly recommend finding the corner of a wall so you have support in case you lose your balance. The prerequisite for this is standing, surgical leg behind, non-surgical foot in front. Adding a light arm swing and timing yourself for 30 seconds. If you feel confident and comfortable doing this motion with almost no loss of balance, you are ready to move on. Grab a weight. I'm using a 3-pound weight. I would start lighter for this one. You can even use soup cans, water bottles, 1 to about 3 pounds. Adopt the same foot position, but now you're passing that weight back and forth. What this is doing is challenging your lateral balance, helping to build stability in the knee. The heavier weight you use for this, the harder this will be. But again, start conservative and then work your way up. Count 20 passes. So every time that weight exchanges hands, that's 1 repetition. Then again, you can compare it to the other side. The leg that's in back is going to be accepting most of your weight and doing a lot of the work. You can then see how your non-surgical leg performs as well, so you can compare your progress. If you want to continue building strength, continue improving your balance, so you can go out and enjoy the adventures that you'd like to, Adventures for Life is your next step. It includes follow-along workouts with me, along with tests to pass along the way to make sure you are progressing appropriately, so there's no guessing. I'm offering an exclusive free trial so you can give it a go. I don't want your money until you know this is what you need. Click the link down below to join in, and I cannot wait to see what's in store for you.